There's a new warning that overuse of antibiotics is substantially increasing the risk of common infections becoming resistant to the drugs. Scientists in China have identified bacteria, or so-called superbugs, able to shrug off the impact of the antibiotics. Here, doctors and pharmacists say patients have to be better educated in the correct use of the drugs. Our Western correspondent Jerry Foley reports.
Modern medicine can deliver some truly remarkable outcomes. But most, if not all, the treatments for infectious diseases rely on antibiotics to kill the bugs. For years, global health officials have been warning that overuse of antibiotics could lead to some diseases becoming drug-resistant, making them useless at critical moments of patient care. This latest report from China only adds to concerns that we could be heading towards a major tipping point.
I think it is very much a wake-up call, because we know that globally antibiotic resistance is one of the biggest threats to human health. The World Health Organization, the European Centres for Disease Control, even Barack Obama this week have all sort of been highlighting how much of a threat this is.
At home, the Irish Pharmacy Union has been spearheading the campaign to better inform patients, for example, that colds and coughs are viral infections and don't respond to antibiotics.
For something like the cold and the common flu, we shouldn't be running off to the doctor and getting a prescription for antibiotics. In any event, the doctor probably won't prescribe antibiotics in that event, and that's simply because they don't work. If you do take antibiotics, for example, that you might have at home otherwise from a previous infection that you haven't finished, well, in that case what happens is that you can actually develop individual resistance to bacterial infection.
The last thing chemists want to do is to scare people, but the expert evidence is pointing towards a dangerous trend which will affect all of our lives.
We have this resistance problem. It's been confirmed in China. We could see an antibiotic post-era apocalypse occurring if we do not act quickly.
Perhaps the advice should now be stop taking the tablets, unless of course they are absolutely necessary and appropriate. Jerry Foley, Ireland Live News.
Now, don't go anywhere.